Okay, I think we're pretty much here. Just remember that you've got to unmute yourself to talk. And if I see you struggling with that, I'll try to unmute for you. You know, but like last meeting, if you kind of raise your hand, as silly as that sounds, I mean, I'm looking at all y'all, and that helps me do it. I was trying to get it here. There we go. Okay, so we're following up from our meeting last Friday we had, and I know everyone's very busy, but I felt it important, as I think some of you all have expressed, to stay in contact and to see where we are. There's some timely things going on, and also some issues that are still out there. Just quickly, since I get to talk first, you know, we're still struggling with issues with DHEC and how they're administering this. Representative Hennigan's on the call, and she's been trying to work on that some, and we'll give her an opportunity to talk here in a second. I watched the board meeting from DHEC, and you know, it's clear that that they're distributing these vaccines by giving them to regional hospital systems with no real direction on to, you know, what, once they get it, where it goes. So there doesn't appear to be, you know, here hospital system, here's 1,000 doses, but 200 need to be set aside for a county that doesn't have a hospital. That's not happening. So obviously, with all the pressure for these vaccines that we see, you know, those numbers are diminishing by the time they come to, you know, the outlier, the places like us. And so that's very frustrating. Also, I didn't watch the whole meetings, and then apparently they voted to prioritize urban areas. Now, the part I did watch, they went on and on about how they were focused on rural areas. So when I saw that, I was kind of perplexed. And it doesn't make much sense, because the numbers of citizens in the rural areas is just a rounding error in the total population of South Carolina. So why would you even draw that distinction? You've already prioritized things based on, you know, first responders and that sort of thing. So that stuff's still going on. So anyway, just to try to move things along, I wrote down sort of an agenda. I didn't share it, but to keep me in line here. So the first thing I was thinking that we could run through is there is at least one planned event that, from what I understand, is not going to be just blasted out in the community, but I think this group needs to know about it, since we're sort of the ones leading this. So Sully, you're muted, if you can say a little about that.
Yeah, thanks, Ron. So this Friday, McLeod Health Sherrall will be hosting a vaccine clinic at the community center, Bennettsville Community Center, from 8 to 1, or until all available vaccine is utilized. Of course, this clinic is for phase 1. It's important to know that those that show up will need to bring identification and or a badge for registration and verification. It is a first come, first serve. So we encourage those that are interested to show up early and to register. There will be a process when they get there to register. They will take a number or a ticket, and there will be additional information provided then how the process will take place. So right now, of course, we have an estimated about 250 vaccines is what I understand. Everyone that shows up will receive that vaccine. If there are, these vials have, from what I understand, extra doses in them potentially. So once we go through those 250 who show up and register, we are going to take names and numbers of overflow, is my understanding, and they will start calling those people and asking them to come back up for the additional vaccine if it is available. If my math is correct, there potentially could be an additional 60 doses. Just for information, if I may, Ron, for everyone that gets their vaccine this Friday, they will be eligible for their booster or second dose, which will be given on the 19th of February, same location, same times. they will have a fixed, yeah, I see Elizabeth. They of course, that will be held for them. You're muted, Elizabeth, if you're.
That 19th is not available. The facility is rented.
Yeah, that's a problem.
Yes, it is.
Okay. All right. So we will,
Now that event is scheduled is a wedding, which very well may get canceled, but we don't know.
Okay. Well, let's do this because it's important that we provide concise and correct information to those who show up Friday. We will have a date to give them before Friday. So I will get right on that. Maybe the day before. The issue too is I think they like to give that on Friday because the second dose tends to have, if they're going to be additional side effects, that's when they typically show up and giving folks the weekend to kind of recover. So we need to get a location and date. Ron, if that date, if we need the 19th, maybe we find another venue.
Yeah, I put that down as an action item, so we can help with that.
I appreciate it. One last thing, if I may, I don't want to take up too much time. Just it's important too that the folks who get their first vaccination, and this will be communicated to them on Friday, if they do not show up for the second dose or they're not available for that date and they choose to get it somewhere else, it's very important that they make sure that the administrator knows they took the Pfizer vaccine. They cannot take the Moderna. That's pretty widely known, but just for information purposes. Anything else that I can help with on that, Ron? Anything that you think I may have left out?
Anybody have any questions for Sully?
Yeah, I do.
No. Okay.
Sully, I talked with Bren yesterday, and he was thinking that on the second dose, that they may also have additional doses that day that where they're going to be able to do first doses as well.
Yes, sir.
So we discussed probably looking at a larger venue to host that.
Yes.
So what I'll do, if you want me to, I mean, I'll go ahead and start working on that and finding a bigger location, and look at the 19th as the date because that might be a good idea.
You got it?
Sorry, yes, I lost. I think I got you, Steve. Thank you so much for your help on that. Yes, please drive with that. Let's go ahead and get that that facility secured so that we're able to share that on Friday.
Is Dr. McCord, are you on call?
Excuse me, Ron, before you get him, let me just say, I'm on the floor. We're still in session. And I would like to make just a quick note, if you don't mind.
Yes, ma'am.
Okay. The Ways and Means met with DHEC today, and they took into account Ways and Means, the elderly population, the rural area underserved, transportation, making sure it was fairly distributed. They're doing away with the per capita and making sure that they're going to use the regional approach. And what I want to do is I'm going to get someone to scan both of these amendments to you so that you can share them with others. And then I'm not only you have some questions, I'm going back on the floor.
Well, we were hoping for an update on the action items from last week. Are you able to do that? Or?
Yes. Okay. I met with David Bond. I met with Ellen. I have a meeting with the governor at 10:30 in the morning to see what can be done. I'm hoping that with the amendments that have been changed lately, that we will be able to get more supplies. I understand that we will be able to get probably in the state about 16% more. According to what I sent you all today, they were saying they were cutting the ones in rural areas that is no longer going to take place. In fact, you should get more supplies than what we allocated, what we asked for in the beginning. A lot of what the Scotland County, they're working on that. I talked to them earlier. I don't know if you have had an update from them. I gave them your number as well as gave them Sully's and Jane's number. So in case they could get one of you all on the phone to talk about that issue.
Yeah, Representative Hennigan, I know you saw the email from Greg this morning about their application. And I checked with him just a few minutes ago, and he has not had any response from his email this morning to you and Ellen.
Okay, he sent it to me, but I tried to get Ellen a few minutes ago. I've been trying for about 2 hours to get her. I have not been able to get her on the phone. I understand that they were in meetings, and if I can, as soon as I can get her, I promise you, I will get back with you.
Okay,
I
so
also
if there's
have
anything we can do, you let us know.
Yeah. Well, I want you to know now, I have been spending the time meeting with them. It's like rounding up, I don't want to say the word, but anyway, it's very hard to get people to make a decision quickly, but it's not from lack of trying to be able to get them. In fact, being able to even get with the governor has been an act of Congress to be able to get him sit down, especially when I gave him the list of things that I wanted him to respond to, which was why didn't you respond to the administrator's letter? Because they are concerned. I also made sure that I let them know that the Marlboro County, I'm gonna have to go vote and I'll be back. Just give me a second to go vote and I'll come back. Ron, I'm sorry, but
That's fine. That's fine.
okay, I'll be back.
I'm gonna mute you.
Ron.
Yeah, who's that? Bird Odom? Yeah, go ahead, Bird.
Yeah, Ron, I think as of yesterday, and I guess we can get it verified, that Scotland County has suspended doses for South Carolina because they had so many for North Carolina. And that was what was told to a lady in McCall, that she went to get her. They called her and told her she could not get a date right now because the doses were short and they would limit it to people in North Carolina. You can verify that, I guess.
Yeah, I don't know that that's accurate. Jane or Dr. Nobles?
Yeah, that is not true, because what happened was North Carolina cut their supply off. If you recall, they had that mass immunization on Friday of last week and immunized like almost 800 people because they were told they needed to use 90% of the doses they had to continue getting dosage. And then after they did that, the state said they wouldn't be getting any because they shot it all to Charlotte for the deal at the Charlotte Motor Speedway. So they didn't get an allocation this week, so they're not giving any pretty much to anybody. But I don't believe that is correct, that they're limiting it to people who are just from North Carolina at this time.
No, Greg, I asked Greg about that last night and he said, no, they were not limiting. If they have it available, they will be giving shots. And as soon as they get more available, they will fill the appointments of those that are waiting.
Yeah, I think that's what I heard too. So I think what it is nobody's getting shots. It's not any particular demographic. And in fact, I talked to Greg Wood. Greg Wood is the CEO of Scotland Hospital. We're talking all these names and other people might not know who we're talking about. They're ready to roll once they get stuff, and they think it's gonna open back up. But I know Representative Hennigan had to go, but we sent all that stuff this morning at 8, so it is frustrating that we can't get anything out of DHEC.
I'm sorry that they're taking so long, Ron, to respond. One of the things that I wrote in the information when I had to give them a list of the things that were pertinent to Marlboro County is the fact that they never even responded to the letter from the Marlboro County government. And that was one of the top things. The other was, what are they doing to be able to support being able to get vaccines in the rural areas? And that is something, that was another question that I had for him, as well as the decision that was made by DHEC to look at urban areas instead of looking at rural areas, but that has been resolved now. So those were some of the things that I put on there to discuss with him.
Okay.
And your list, and thank you for that list too. I use that also.
So that meeting's tomorrow?
10:30, yes.
Who all's going? Is it just you or other counties too, or?
No, it's he set it up for me, and I've asked Jackie Hayes to consider coming in on that meeting, and he'll let me know.
Representative Hennigan, were you able to get in touch with Senator Malloy? What's his take on it?
I have not been able to reach him as of yet. I've left word for him He's been in session, so I am going to ask him today. I'm going to find it one way or the other and ask him to be a part of it. But so far, he has not responded back.
From last week, he hadn't
Oh, I
responded
didn't
back.
ask, no. I'm talking about just since I got that appointment for today. That's what I was talking about.
Okay, I
Since I
thought you
had-
were gonna meet with him last week to see if he could help push some too.
No, I haven't met with him last week. I didn't know that was one of the things that I should do, and I didn't.
No,
But I did talk to, I'm sorry, go ahead on.
no, you just, in the call last week, you said you were going after the call to meet with him. I think that's where that's coming from. So we were just
Okay.
curious
That
what his
is-
take is, since he's the chairman of the delegation and we
Okay.
haven't heard
I
anything
will
from him.
get with him today. I will get with him. I have been busy, and I promise you, I will get with him. I just haven't had the time. We've had so many issues coming up, and I apologize. But I can tell you that I did meet with an hour with Ellen and David, even yesterday afternoon, to talk about our issues for Marlboro County.
Okay.
And Stan, I'm so sorry if I was, that I have not, but I can tell you, I've been meeting with everyone you can think of, including the Ways and Means to see, could they take this funds and use it only for urban when we need it in the rural areas. So I have been working on this, but I will get in contact with him today.
Yeah, it's really sad to see that they run their agency by individual requests from legislators through their lobbyists. I mean, it's just
And you're
indicative.
right.
It's indicative of a
You're-
big problem that needs to be resolved quickly, and I just don't see it happening. But I'll try not to rant and rave.
Well, I'm gonna just tell you this. This is one of the reasons why they met with them, the Ways and Means, because it was brought to their attention. We brought it to their attention, several of us in the rural areas, not as a group, but because they went to the meeting so that we could bring this up as an issue. And believe me, they jumped on it very strongly. And they called them in and they had a meeting this morning.
Well, that's good, because I think it's not a cabinet position. I don't think, is it? It's a House.
No.
I mean, a
Right.
General Assembly thing.
Right, that's exactly. And one of the things that I can tell you, as they said today, they understand money. And they understand that they're not getting something if they can't do it the proper way. And one of the things I wanted to mention to you, but I said, I'm not going to bring that up now. We went back to look at they were on the board, and board were making decisions instead of MUSC and DHEC. And every one of them was from either the Columbia area, Anderson, South Carolina. Not a person that you can think of was on that board for DHEC to represent PD area. So that was a major problem that we saw. That was major reason why so many things are taking place and so much of the vaccine is going into those areas.
Okay, so I'm sorry, somebody else. Who was that?
Yeah. I was just gonna say, do we know a comparison to what? I say either McLeod and Sherrall gets, or is it a daily dose that they get prescribed every day? Versus,
Let me tell you, all the areas have been having major problems trying to get dosage. In fact, I talked to y'all, and they're still having problems trying to get doses. And then I talked to Jackie Hayes. When they they thought they were going to get 200 or 300 vaccines. They ended up at one time just getting 100, which was really embarrassing for them. Whenever they had so many people that they had told that they would be serving, and they could not do it. So it's not just in our area; it's all over.
Well, so of the action items I had down, trying to get Scotland approved, or at least get a response. There was a question about like Dr. Noble's situation of trying to make it to where volunteer doctors or semi-retired doctors could do it.
That's the last one we got now for the amendments. They can, and I'm going to send you that today. Okay. As soon as I can.
How quick can that actually happen, though, if that's happening through legislation?
As soon as they sign it, we can do it. It's an amendment, and it was already approved today.
Does it have to go to the Senate?
You know what? That's a good question. I don't think so, but I promise you I will check in just a few minutes. I
Okay.
don't think so. But I think the Ways and Means for the House can take care of that issue. And I think it's already been resolved because they said that they had resolved it.
Did anybody else have anything for Representative Hennigan? I know she's, needs to get off the phone.
No, I'm going to go over there and see Gerald Malloy before I get, as soon as I leave here. And
Okay.
then I'm coming back over myself because we're going to be here for quite some time.
Okay. Okay. There. So, okay.
Gerald, Ron, was there anything else that I failed to get that you all asked me to check on?
I don't, the Scotland thing, I think I was interested in the things that could happen more quickly. I think Scotland was one, and potentially Dr. Noble's situation in case we have some partnership with someone to do a vaccine.
Right.
And then the other things are big picture things like the way they're allocating these.
Right. When you see the amendments, you will see a lot of that has been addressed too.
Well, I hate to be the doubter, but I'll believe it when I see it.
I know.
I put my hand.
I feel the same identical way, but you know what? I can tell you it was a 100% vote from the House to get these things passed and House to make the amendment. So if that's anything, all of us adopted it.
Well, I'm hoping that what I'm sensing is that you folks in the legislature have finally reached your wits' end with these folks and are going to do something.
That's not the word for it.
It's frustrating. Now, Jane Rogers has her hand up.
Representative Hennigan, you may have said this earlier and I missed it. Did you have any idea of when Ellen or somebody from DHEC was going to get back with Scotland? They sent their documentation in again this morning.
Yeah, I tried to get her on the phone. I for the last hours or more, I've been trying to get, I assume they're still in meetings, but I don't plan to give up on not getting the answer from her today. I have
That's
her.
good. Thank you.
She gave me her cell number. So if I have to use that this afternoon, I'm going to do whatever's necessary to get back in contact.
Okay. Thank you.
That was surprising to me that they didn't have it.
Yes,
well, it's
very
not surprising to me if you deal with DHEC. They've got it, but the right hand doesn't know what the left hand's doing. And
okay,
it's more surprising that their lobbyists on the floor of the General Assembly is handling policy issues on a case-by-case basis. But anyway, I said I wasn't going to rant anymore. So
yeah.
Appreciate what you're doing and trying to keep their attention. We talked about McLeod event. Is there anything else that's firmed up definite that anybody knows about?
The only firmed up event, Ron, that is right now, as you know, is the second dose, February 12th, for the folks that took it a couple of weeks ago at the community center. That is obviously firmed up, and that's going to be just for the second doses, not for any first doses or anything like that. It's specifically that. If I could say one thing, I don't know if anybody watched DHEC's live briefing on Facebook. Probably not, because only 29 people were watching. I find that amazing in a world where we have a pandemic and nobody's watching this stuff. But Dr. Traxler, she kind of explained the supply chain and how it works. Just so we know, is that a lot of these big providers like McLeod and stuff, they get their allocation directly from the manufacturer being managed by the federal government sending it to them. It doesn't come like through DHEC or through wherever. It goes straight to the providers. And next week, they're supposed to get an additional 10,000 doses of Moderna in addition to their normal allocation of Moderna vaccine. So now, will that continue every week? We don't know, but I thought it was pretty interesting to say that. And she couldn't say where those 10,000 are going to be allocated to. That'd be a perfect thing to move towards the rural areas, but
Yeah, it would definitely.
See what happens.
Jane, you're muted, but he had something.
Okay, well, this is not, the only firm part about this is that MUSC representatives Joe McCall and Dawn Seals are coming Friday to meet with Ron Munnerlin, Steve Akers, Calvin Cassidy, Dr. Nobles, and myself to see if we can't, with the three organizations together, get some type of vaccine event pretty soon here in the county.
Okay. Anybody else have anything like that? I see Dr. McCord's on here. Dr. McCord, is that you?
Yes, sir.
I'm used to seeing your bow tie. All I see is your name, so I didn't catch you there. There.
I'm right here, Ron. There you go. There's your bow tie for the day.
My phone thing for you is a picture of a bow tie.
That's a good
I
picture.
hate to know what the one for me is on your phone, but anyway, if we get in a situation where we need a larger venue, I guess, we'll come to you, but I mean, when the schools go back into hybrid or in person, I guess that would sort of hamper some of these venues. Is that correct? If we needed a school.
We actually were in conversation with DHEC a few months ago about hosting at the high school, and then that kind of cooled off. Last week, we, ironically, right after the Zoom that you had, we were notified that was on hold. But whether we're in or out of session, we feel pretty comfortable we can host a site if need be, if it's required. We can utilize the back parking lot as well as the athletic facility on the lower side of the campus. And I think we can travel people in and out without it causing too much delay.
That's good. That's good. So we'll stay in close contact with you and let us know, or Steve Akers, if there's something we can help on your end. That's great to have that. It looks like to me, having gone to the first event they had at the community center, that, parking is an issue because you get out in the field, and then the staging area, really more of the recovery area becomes an issue because they sit the people out apart. And so, as we go forward with these different events that folks are having, we can tweak it as we go and make it better and better. So that's good to know. We'll certainly.
The way it looks now is all of the vaccines, from what I hear, Steve's going straight to the hospital systems and not through DHEC. Or is DHEC controlling it?
Right. In fact, DHEC, when they came here, their allocation actually came from the Florence Health Department. And where it came to from there, because I guess it was shipped straight to them as a provider. So yeah, that's a good question. I don't know how they got a hold of that, but I'm pretty sure that's along those lines.
And Sully, you may be able to answer. Do you know how many you're getting over in Chesterfield County a day?
I do not. I know the allocations are issued first of the week, and they have varied.
But it's a daily allocations. It's for daily allocations.
I'm Jason. I'm not 100% sure on that. Sorry, I don't know.
Okay.
I thought those were just issued. The numbers were issued first of the week, so I'm not really sure about.
Yeah, I think they're weekly too, Sully, because based on what Bren was telling me and talking with DHEC, I think is each week they get a certain amount, because that's why you'll hear them running out like Wednesday and so forth. So it's
right.
And the reason I asked is one of the guys that went for his second shot. They were supposed to go Monday and they said to run out, and they had to go back yesterday, I think. So I was wondering if there was a certain amount every day that they allocated it, or if it was just weekly, if they got them Monday, Tuesday, Wednesday, Thursday, Friday.
Well, Jason, speaking to that, I mean, if it was the second shot, my understanding is if you get the first, your second shot is, they save that, they set that aside for that particular individual to get. So I'm not sure why they would be, if they showed up at their appointment or for their second, that we need to check on that, because they should have had availability. We've been assured.
I don't know if some of the things are, whenever they got their first shot, if there was a space where people were not notified exact the next time or the next date. I know they should have, but I was told that they ran out Monday and had to get back yesterday. So I just didn't know if there was a number for Chesterfield County.
Oh, wow. Okay.
Well, and that's the kind of the crux of my concern is that, it's only natural that all this pressure on these things, and the in some cases slow or no response from folks that are, they say this group can have it first, and then those people aren't responding quickly. So it's like, do you hold this? Do you release it or whatever? And I mean, I think that's causing problems. And some of it's just going to happen until you have this abundance of doses and it doesn't matter. But
Right.
But it is concerning to me that you're giving it to hospital systems that serve multiple counties with doesn't appear to be any direction on hold this for this county, hold this for that county. And I'm not picking on McLeod, it's every hospital system in the state. Those folks are doing the best they can. Okay. So the only action items I had, well, first of all, did anyone else have anything else to put on the action item list? I guess I should say.
Ron?
Yes, ma'am. You muted yourself. There you go. No, you muted yourself again. We can't hear you, Elizabeth.
There? Okay.
Yeah.
Christy Meggs from Northeastern called me this afternoon to remind me to tell you that Northeastern Technical College campus in Bennettsville is an approved DHEC vaccination site. And when I spoke with Mark Hendricks and DHEC Florence earlier, I questioned that and he said yes. So they are prepared to offer that facility if necessary.
Okay. We'll make sure we keep that in mind. If we get enough to do something big, that would be a good place as well. They have some open space still there in the middle of the building, I think. Okay, well, what I have down is to continue to follow up on the Scotland Hospital ability to vaccinate in South Carolina, which is, despite efforts from Representative Hennigan and all of us, is not going anywhere fast for some reason. And the thing about, folks like Dr. Nobles being designated as approved providers in case we have the ability to do some joint vaccination thing and we need somebody to be the doctor. Representative Hennigan's meeting with the governor, so we'll see how that goes. Not sure, now as we've moved weeks away from writing the governor, I'm not sure what he can do because it's not an agency. It's not one of his cabinet members, but I mean, he has the ability to do executive orders. So I guess, he could do something. I don't have anything else on there other than to continue to share information. And, we can have these meetings more frequently. I'd rather not because we all have plenty to do. But there does need to be some clearinghouse of information. And I think folks are a little bit apprehensive of putting stuff on social media because it becomes, a lot of stuff. And then in situations where you have, a facility being used by another organization, you're going to get bombarded. Like the city could get bombarded with questions. Oh, you're doing an event. It's really McLeod or, whoever. But, there is a long list on here of people invited to this, and I can narrow that down to folks that have some, who are contact points for every organization on this, and start trying to share that in a email, back and forth. I personally don't see any reason not to share information. I may be missing something, but we all get questions. I'm getting questions. I know Max Alderman keeps calling me. He's getting questions. So we need to know what's going on. So unless anybody has a problem, I'll try to start a fresh email and send it out to everybody, and then everybody can reply all to use that to share what they can. And then it just, we're on the honor system not to, if someone puts stipulations on the information, then we're on the honor system of not going out and posting the email on our social media thing, because there is some information that's still in the oven a little bit. Is that okay with everyone?
Yeah.
Or is that not okay with someone, I guess? Okay. Is there anything else that anyone wants to bring up? Yes, Elizabeth. Can't hear you.
How is the public to be notified?
Of what?
Events?
Well, I think it's on an agency by agency basis to say, here's what we're doing and here's what we want out there. Okay. I'm just hoping that we can.
I agree, but I was questioning.
Yeah, I think each agency owns their event. I'm just hoping for a sharing of information so that those of us that are always, asked, at least know sort of what to say or not to say.
I've
Hey,
had
Ron,
5 calls while we've been on this call. I've had 5 voicemails left. I'm sure that's what it's about.
Yeah. Sully?
I was just going to say, I forwarded you a copy of the communication or the flyer McLeod issued earlier today. I believe I sent it to Jane as well as Representative Hennigan. And you can disseminate that as you see fit.
Okay.
We share that with, our team.
Well, and I think this first event that's happening, was, it was a desire to keep it low key, but I'm afraid the cat's out the bag. And
Sure. Yeah, you're right. We'll learn, get better.
Oh yeah, well, I mean, this is not something.
The vast majority of these events though will be by appointment only, I'm pretty sure.
Yes,
Simply
sir.
because that way you know what you've got and you know what vaccine you got, and that'll keep it down. It's very difficult. It's going to be very difficult to do just a walk-in without having like a stadium, and 500 people poking needles in people. I don't say you can do it any other way.
I agree.
I did see something, I think I may have shared it with you all, where the mayor of Mount Pleasant, South Carolina, has drafted the manager of the Chick-fil-A to help organize the line for their vaccination. And I think that, that's humorous, but that is exactly what needs to happen. And DHEC needs to step up and think outside the box and do these things. There are private sector individuals that know how to do this very well. And hopefully they'll see that. Who knows? There are a lot more people in Charleston, so maybe that'll get a little more, people will pay attention to that than they will poor old Marlboro County. So anybody else have anything? If not, I appreciate everyone getting together on an afternoon, and we can do these fairly quickly without much notice. We miss a few people when we do that, but we can do that if there's a need to call a meeting. So just let me know, and it's not that hard for me to just pop this out to you. So we did want to get together today because there were some timely things, and we wanted to hear from Representative Hennigan and also, share with information with everyone. So thank you all, and we'll talk to you soon, and keep your eyes out for emails.
Thank you.
Thank you.